Hi, everyone. My name is Stephanie Fitch. I am the grant manager for the Montana Obstetrics and Maternal Support, or MOMS, demonstration project out of Billings Clinic.
And my name is Dr. Sarah Reese. I'm an assistant professor at the University of Montana in the School of Social Work and also the principal investigator of Empaths.
Today, MHLIC has asked us to talk about the Empaths perinatal substance use pilot study and 18 months of lessons learned as we've implemented this program here in Montana. We are HRSA funded as well as contracted through the Montana Department of Public Health and Human Services, and our statements herein do not necessarily reflect the opinion of any of those entities. So the Empaths study, we implemented a healthcare system level treatment model where we implemented universal screening for substance use in pregnancy and in the postpartum period, initially in the OB setting at 12 weeks or that initial OB visit between 28 and 32 weeks, and then at the postpartum visit, really just looking for patients that may be struggling with their own use or the use of friends and family members that are close to them. Patients that screen positive for substance use concerns are referred to a centralized care manager who conducts screening, brief intervention, and referral to treatment sessions via live and telehealth appointments. This was initially piloted out of Billings Clinic and has expanded to rural sites in our region. As you can see by our model, the program really works with universal screening in the OB or primary care setting. If a need for further screening and assessment is identified, that patient is connected to our care coordinator who can really set moms up not only with behavioral health providers, but also with social service providers, whether it be home visiting, nurse-family partnership, other social services like WIC or Medicaid, as well as that addiction treatment or mental health therapy programming. And once patients are engaged with those providers, our care manager sticks with them and just helps them get connected to any services they may need throughout the process so that they are safe, healthy, and ready to parent when baby gets here, or connected to additional supports to just help them be the best parent they can if the need is identified in that postpartum period.
This is the screener that we used for universal screening called the 5 Ps, which was really adapted from the 4 Ps, Chasnoff's 4 Ps. And it simply asks these 5 questions. We did a soft launch of Empaths in January of 2021, really communicating to the organization that our care manager was a resource, and then more formally integrated the tool into protocols in April of 2021. And then we have been, seeing patients over that time and have expanded in July and August of this past year. Thus far, we've screened 419 women using the tool. 109 of those women have screened positive or answered yes to one of those questions, and were then engaged by their provider to do some evaluation and determine if there was a need for referral. 74 women were referred to the centralized care manager, and 41 of those women were successfully referred to at least one service. Some barriers to referring women were not being able to contact them, not determined not to need a service at that point or refuse services. With our findings, we have found that some women were experiencing perinatal mood and anxiety disorders who screened positive on the 5 Ps. And based on that finding, we're expanding the program to screen more thoroughly for PMADs and suicide severity risk. With interviews from and focus group from providers and patients, we found that SBIRT is determined based on their experiences appropriate and acceptable and feasible to implement in this clinical setting. Patients in particular highlighted feeling accepted and supported by their care manager, and really that value of consistent follow-up. We also identified some different barriers to implementation, challenges with integrating the screener into the electronic health record, a need for outreach and provider engagement, increased outreach and provider engagement, and to address discomfort and addressing substance use with patients. And one way that we are addressing these is moving this into the electronic medical record, and then also expanding our existing simulation leadership training to provide simulation trainings to providers to increase their competency and their comfort in providing SBIRT and engaging patients through motivational interviewing.
So as we've shared, Empaths really does provide non-judgmental care to pregnant and postpartum women experiencing substance use disorders and mental health conditions. But as much as Sarah and I love the program and rave about it, we think the best way for you to really understand the value and the difference this program is making is to hear from one of those patients. So we're excited to introduce you to Kyle, who was one of our first patients in the Empaths program. She's really flourished, utilized this resource, and just become a really active, not only person in recovery, but an incredible parent as well. So we want you to take a look at this video and hear her story.
I got connected with treatment services and other resources immediately. From there, the services just branched out. There was resources that it just opened the doors to so many resources. The care manager, Joe Sallier, he was awesome when he came into my room. He just made me feel like I mattered.
I've seen mothers reunited with their kids. I've seen the smiles and heard the laughter. It doesn't get any better than that.
They care, they really care, and once you open your mind and your heart, there's so many resources, so many people. There's just a community of people that love and care and want to see you be a mother and take care of your children. My boy, his name is Shad. He just turned 3 months 2 days ago, and he has just flourished.
So thank you everyone for watching our Spark session. We're honored to be here talking about this program that means so much to us. If you have any questions, please do not hesitate to reach out. Sarah and I really look forward to hearing from you. Thank you.